Yesterday, the Department of Public Health reported 102,000 new tests, bringing the cumulative total to about 11.3 million. 6,419 new cases were reported, bringing the total to over 386,000 cases confirmed since the beginning of the pandemic in Massachusetts. The 7-day average of the positive test rate is 8.25%, and right now there are about 80,000 estimated active cases. There are currently around 2,400 people hospitalized for COVID, and 442 of them are in the ICU. As we all know, Massachusetts is fighting its way through a second surge. Cases are growing, and hospitalizations continue to climb. This trend, as we know, has been going on for weeks, driven in part by people letting their guard down in informal settings and over the holidays. Before Thanksgiving, our 7-day average of new cases was about 2,500 per day. Today, that figure has jumped by 91%, with a 7-day average of new cases at almost 4,800. That puts a lot of pressure on our healthcare system and our hospitals. It's also putting significant pressure on our healthcare workers, who continue to do an incredible job on the front lines fighting COVID every day. In the past 6 weeks, COVID hospitalizations have grown by 145%. During that same period of time, ICU admissions due to COVID have grown by about 111%. On Thanksgiving, our hospitals were about 65% occupied. Today, they're 84% occupied. And our ICU census also continues to rise. It was just over 50% at Thanksgiving, and it's now at 75%. The administration and the command center have taken several steps to support our hospital systems and better prepare frontline healthcare workers. We've stood up 2 field hospitals to create more beds, one in Worcester at the DCU Center and a second that launched earlier this week in Lowell. These facilities help ease the burden both by treating seriously ill patients and by taking in lower acuity patients. But as the healthcare system absorbs the magnitude of the impact of the holiday season, they need more relief. Today, we're announcing new steps for hospitals to expand ICU capacity through a more flexible model. And effective today, hospitals with certain capacity restraints will have the option to temporarily request an exemption to mandated nurse-to-patient staff ratios in the ICU. The Department of Public Health is also moving hospitals in all regions of the Commonwealth to Tier 4 status in their hospital preparedness plans. So we remain committed to supporting our world-class healthcare system and our incredible healthcare workers. And we believe that these steps, among others, are crucial to ensuring that they can continue to provide the care to all the patients who need it as we battle this pandemic.